Hi, my name is Cassandra Henderson, and I'm going to do a presentation on atrial fibrillation and anticoagulation. Atrial fibrillation is the most common cardiac arrhythmia. It accounts for nearly a third of cardiac rhythm disturbances related to hospital admissions, and approximately 32 million people worldwide are affected by A-Fib. It poses a significant risk for ischemic stroke. Anticoagulation reduces the risk of stroke occurrence. The pathophysiology of A-Fib, an irregular electrical impulse from the atria causes a disorganized heart rhythm. Can cause a rapid ventricular response with a heart rate between 120 and 180. And basically, it results in an incomplete atrial emptying. This can cause the blood to swirl in the atria and pool, which can cause blood clots. It may have no signs or symptoms. Often the only reportable symptom is fatigue. Other commonly reported symptoms include palpitations, dyspnea, diaphoresis, and dizziness. Severe signs can include pulmonary edema, stroke, chest pain, and hemodynamic issues. Diagnosis is often made with an ECG, and it's an irregularly irregular heart rhythm. Causes and risk factors for A-Fib can include surgery, pulmonary embolism, alcohol ingestion, hypertension, CHF, CAD, obstructive sleep apnea, and advanced age. One of the medications that's used, it doesn't fix atrial fibrillation, but it helps prevent blood clots, is called warfarin. It's an anticoagulant or a vitamin K antagonist. Its mode of action blocks the formation of clotting factors dependent on vitamin K. And for many years, warfarin was the gold standard for stroke prevention, but it has fallen out of favor for medications with fewer limitations. Some of the limitations with warfarin include more than 120 drug and dietary contraindications. It has a narrow therapeutic window, a long half-life, and bridging is needed. Safety-wise, you should have an INR checked often, and you're at increased risk for bleeding. The cost is cheap, it's covered by most all health insurances, and the expected outcome is stroke prevention. Another group of medications that help prevent stroke, they're called direct oral anticoagulants. Some examples include Pradaxa, Eliquis, Xarelto. The mode of action for Pradaxa, it interrupts the coagulation cascade by blocking the clotting protein thrombin. With Eliquis and Xarelto, it interrupts the coagulation cascade by blocking activated factor X, which is needed to form clots. They are now considered the gold standard of treatment. They have a lot fewer negatives, a lot fewer limitations than the warfarin does. And in some studies, the direct oral anticoagulants were as or more effective at preventing a stroke in patients with atrial fibrillation. They have a shorter half-life, no bridging is required, and the therapeutic range is reached quicker than with warfarin. Cost, it's more expensive. Not all insurance companies pay for every medication, and the expected outcome is also stroke prevention. It can have certain genetic issues. It can be due to genetic and other non-modifiable risk factors, such as age and gender. It can be due to environmental and lifestyle choices. Nurses can provide education about weight reduction, alcohol moderation, and increasing physical activity. It can also be due to certain comorbidities, such as chronic kidney disease, CHF, hypertension, and sleep apnea. Patients can be taught about their medication, their dose, their common side effects for the medication, common signs and symptoms of blood clot, bleeding. They can be taught about the lab testing they need done, and it can help prevent serious complications. And that's the end. Thank you.